What is up, my people? How are we doing? Again, we've already covered red blood cells. Again, there are three different portions of blood that we were going to cover: red blood cells, white blood cells today, and then platelets on a different point, either this week or next week. Now, um, again, last week this last portion of notes we kind of focused more on Ian and his case with beta thalassemia. In the absence of that beta protein responsible for the production of hemoglobin. But now we're going to take a closer look at Isla May and her diagnosis of leukemia. So with her, really, we should be right here. Now with her, again, her initial symptoms were very indicative of chicken pox and tonsillitis, because again she had a lot of bruising, red spots, and her tonsils were very swollen. So she immediately got taken to the hospital, where her pediatric oncologist did a CBC blood count, which it really just determines the overall concentration of different types of blood cells, and it found in a sample of blood, and this is what they found. Now, again, looking at oxygen levels with red blood cells, again, we are looking at their overall presence of oxygen, and again, if it's bright red, then it's known as oxyhemoglobin. So there's plenty of oxygen. Again, and then if they are dark red, which these are definitely dark red, they are low in oxygen. So they would be deoxyhemoglobin. Now, if just by looking at this and looking at all these different blood cells that are up here, again, you have a whole bunch of red blood cells, and then a pretty big concentration of white blood cells. Not white blood cells, but just foreign cells all throughout. How would this affect her hematocrit level? Do we think it's going to be higher, lower, or the same? If you guess lower, you are correct. Again, that's mainly because these are foreign cells due to the presence of leukemia. Now, again, leukemia is normally diagnosed by either looking at that CBC count, but then also by taking a bone marrow biopsy in order to differentiate it even more. And she had what is known as acute lymphoblastic leukemia, or ALL for short, which is considered the most common type of leukemia in children and adolescents. Now, again, if we were to break that up, acute. Yeah, I reckon I do. All right, sorry about that, y'all. So again, if we were to break that down, again, acute referring to a type of disorder or disease that progresses quickly. Lymphoblastic, again, primarily affecting white blood cells, and I'm coming right back down to the name of the scientific name, leukocytes. So how does leukemia affect the body? So there are several types of white blood cells, and again, and how they're involved in homeostasis, and that's really what we're going to take a look at. And so to really have a better understanding, we really need to know how white blood cells work. But just to kind of give us a general idea, they affect a huge variety of different areas of the body, whether it's your systemic system, focusing right around weight loss, fever, and frequent infections. Looking at psychological, so fatigue of the brain, loss and just overall loss of appetite, swollen lymph nodes, shortness of breath, muscle weakness, and then any sort of symptom that's going to either affect your overall red blood cells, just like how we saw with splenomegalia in our red blood cell portion of the notes, as well as just all the same symptoms that we saw with this little girl have, with the night sweats, easy bleeding and bruising, and purplish patches or spots. Now, again, with white blood cells, again, they are really differentiated down into two main types, whether they are uh, granular or non-granular in substance. So really, you can get a really good understanding of what we're referring to here. Now, the three main types that are considered granulocytes, again, that have a granular cytoplasm, so it's a very fine. It normally looks like a very fine, like particle, kind of free floating all throughout the cytoplasm, and which are comprised of these three types: your neutrophils, your eosinophils, and your basophils. And I'll kind of give you guys some general characteristics to go off of whenever we are trying to remember what those are called. And then you also have your granulocytes, lacking a granule cytoplasm, your monocytes and lymphocytes, and we'll dive into each different type here shortly. Okay, now the white blood cells are found within the red blood cells. There are not as many white blood cells, and generally are larger than red blood cells. So as you can kind of see here, each one has their own structural component that makes them slightly different from the rest. And again, we'll dive into each one of those different ones and recall back. Again, I want you guys to really make sure that you're finding whatever learning tool you need in order to really understand the difference between each type, and then make sure that you know the scientific name and not just know that it's a white blood cell. It is good that we at least know that and can differentiate between a white blood cell and a red blood cell, but I want you to really dive into knowing the actual scientific name behind each one. So, again, if we look at this general breakdown, as far as general abundance goes, your neutrophils make up the bulk of your white blood cell count. And if we, and again with granulocytes, again, they get their name from, again, those granules that are visible all throughout the cytoplasm, and most of them have a lobe nuclei. So again, lobe nuclei, lobe nuclei, lobe nuclei, and you can really even tell that a lot of them are either multi-lobed, double-lobed, or if we kind of look over here at our lymphocytes, again, some of them even just look like a big globular of substance that sometimes might even have just a U-like shape or kidney shape to it. Now, the first one, looking at neutrophils, so again, the most numerous or the most abundant type of white blood cell. So with these little suckers, they have they're a multi-lobe, and they have a multi-lobe nucleus that you can kind of even identify here, and consequently their cytoplasm often appears to be more pinkish in color. Um, Sorry about that, guys. I had a bit of a coughing fit, so I paused it. Uh, I'm all right. I promise to I'm good. So again, they are the most abundant. They have a multi-lobe. Their cytoplasm it tends to appear more have a brighter pinkish color. And then one of the other big takeaways from neutrophils is that they have active phagocytes, which again, a phagocyte is really just a cell that engulfs and digests foreign material of any kind. So that's why, again, just like kind of like how you see in this picture here, one of the most common forms of infection that you primarily see them are through the presence of pus. Neutrophils, again, because they are particularly partial to bacteria and fungi, and as a result, they kill during a respiratory burst. And yeah, that's really about all we need to know about neutrophils. Again, they're the most abundant, have active phagocytes, and again, they are primarily present during acute infections of any kind. So these are all kind of different examples of what neutrophil look like. So again, in most cases, they have I'm clicking buttons on accident. So again, in most cases, they have more of a uh, a pinkish or yellowish color, depending on the bacteria type. Now, if you were to look at this this phagocytosine anthrax. So this is really just coming back down to the overall processing of how all these phagocytes in these neutrophils are constantly engulfing and being inhaled. Now, they were often used as an act of kind of a bioterrorism because, again, um, the this anthrax, it tends to have a very high rate of reproduction and has long-lived spores that can be really released without detection. So very common in bioterrorism acts. Xenophils, again, another one of our granulars types. So these guys have a blue-red nucleus that resembles, and they kind of look like earmuffs if you really look really closely at it. Now, over on the right-hand side, you're looking at a scydoscome worm. Again, a very common parasite that xenophils tend to attack. Um, but again, very common with any sort of parasitic infection, tapeworms, which really just help, um, which again really just help gather around and release any sort of enzymes from all these cytoplasmic granules onto the parasite surface, and then as a result digest it away. Your next one, your basophils. So these guys are responsible for producing epinephrine. So they act as kind of an inflammatory response, as you can imagine, and also help deal with really blood clotting factors. So they have a large again histamine complex that is stained a very dark to blue purple within their cytoplasm. But again, probably the biggest takeaway you guys need to get out of this is, again, that they produce epinephrine, which acts as a blood thinner to help prevent clots. But then this is also a common drug that, again, that correlates right back to what you could take as a result of a blood thinner. So between that and then their inflammatory response, basophil is pretty important. All right, now let's take a look at some different disorders behind these little suckers. All right, so starting off with dermatographia. So again, with this one, we're primarily looking at how it acts as a benign skin condition because, again, it causes a series of kind of like small, well, I wouldn't say small, but raised hive-like scratches kind of all throughout your body. And in any sort of pressure or rubbing or friction of any kind can induce this reaction. Now, whereas if you're looking at cold urticaria, again, also known as cold hives, again, you're looking at a similar skin condition, but it appears within minutes after any sort of cold pressure on it. And normally, if people with cold urticaria experience widely different symptoms. Again, a lot of them have a wide range of reactions to being cold, to having very severe reactions. But things such as even swimming can induce this too, because it can lead to very low blood pressure, fainting, and even shock. But no one really knows what causes this cold urticaria. Unfortunately, the one thing that we do know that if you have very sensitive skin cells, or if you inherit the trait that you are as a result have a higher likelihood of having it. But these cold spells tend to trigger all of your histamine and other chemicals into the bloodstream to kind of be induced in a given reaction of some kind. All right, next thing we're looking at are monocytes. So again, these are one of our one of our A granulocytes. Again, that do not have a granule-like cytoplasm to them. Now with monocytes, again, they are the largest of all the white blood cells, as you can tell in their appearance, and they have a horseshoe-like shaped nucleus to them. Now, except for their abundant cytoplasm, they resemble large, essentially, lymphocytes. Whenever they migrate into tissues, they change into macrophages, which again are a type of cell that surrounds and kills microorganisms, removes dead cells, and even stimulates the action of any other immune cell of some kind. Now, dendritic cells, again, are very similar in nature, and that also help trigger an immune response. And they're often found in skin and are known to help boost immune responses by showing some sort of antigen on the surface of the cell, on the surface to other cells of the immune system. And then one of our last ones, lymphocytes. So these guys have a very dark purple nucleus, so you can see that kind of occupies the majority of the cell volume. And it's only slightly larger than red blood cells, and they tend to take up and they tend to be right around in areas of lymphatic tissue, such as your tonsils. So as a result, they play a pretty important role with immune response and producing antibodies. All right, now one of our next things to kind of dive into, mononucleosis. So also sometimes called mono, again, it's the same thing, or the kissing disease. So it's all based around an infection of the Epstein-Barr virus. So it's one of the most common human viruses in the world, and it is primarily transmitted through saliva. Again, give it its name, the kissing disease. Now, overall diagnosis of this disease can be challenging just because the symptoms are very similar to other illnesses such as the cold and flu. But it's all based around an increase of white blood cells in the bloodstream. Now, common treatment methods are, oftentimes it takes a long time to treat, tends to be around 3 to 4 weeks. Really just need to drink a lot of fluids, stay hydrated, get plenty of rest, and take any sort of over-the-counter medicine that would help mitigate fevers and any sort of pain of any kind. But again, all coming back down to a viral infection through this Epstein-Barr virus. And then our next one, looking at HIV. So HIV deals with the weakened immune system by affecting specific immune cells, and in particular these CD4 T cells. So these guys are also known as helper T cells because they help fight infection by triggering your immune system to destroy viruses, bacteria, and any sort of foreign particles that may end up getting you sick. Now, with respect to HIV in general, again, it's all based around this real big imbalance of again, these helper T cells, which can lead to essentially a progressive impairment of your immune system and ultimately lead to death if left untreated. Now, again, if left untreated and not properly taken care of, this is when it can eventually lead to the most progressive form, AIDS, or in other words, acquired immune deficiency syndrome. And this really just happens when the number of those helper T cells gets so low that you start to develop a lot of opportunistic infections, whether it's colds, colds, flus, you name it. Again, a lot of things that will take advantage of your very weakened immune response. Now, there's no real cure, but outside of any sort of antiviral drugs and normal therapy that can help slow down the progression of AIDS in particular. All right. Now, as we kind of wrap this up, again, we're looking at, again, our red blood cells kind of all throughout, kind of a mixed combination of oxygenated versus deoxygenated, again, with our lymphocytes, again, our largest white blood cells that, again, act, and then their dark purple nucleus kind of protrudes around the majority of the cell itself, whereas you have your most abundant type of white blood cell, your neutrophil, again, often characterized as multi-lobed. Really, if it has 3 or more, that's when you know it's going to be more than likely a neutrophil. And again, it is considered a granulocyte, unlike your lymphocyte, and and again, very particular to bacteria and fungal infections. Now, feel free to watch this video. Again, I highly emphasize you guys do. That way we can really dive into those more and make sure you really take a look at this picture in particular. Again, should help you out quite a bit. Now, why is... So again, I'm sorry, I was getting a little carried away on what I was looking at. But again, you should be take a look at this video. Definitely make sure you watch it. But again, when you're looking through these slides, again, make sure that you are taking a look at it and just use some different naming characteristics to help you memorize them. If you need some help with that, again, I have some ideas that you guys can go about doing with it. Now, why is ISOMACE so sick? So again, primarily due to all the different treatment methods that we're trying to do in order to really get rid of all this leukemia. So this first one with remission induction is normally going to be the primary treatment, or in the first one that deals with getting rid of all the of treating leukemia. So with this. Again, the overall goal is to eliminate all the leukemia cells from our bone marrow and blood, and then as a result, have a complete remission. And then just the consolidation and maintenance really just comes back down to repeated blood draws throughout her lifetime. That way, it doesn't come back. And then same thing with the leukemia there. Again, the overall goal is just to treat it as much as possible and do everything you can in order to make sure it doesn't come back. Now, again, with coming back to that consolidation form, again, we're trying to avoid any sort of relapses and making sure that it doesn't come back. And then again, with looking at the maintenance of it, it's really just making sure that it stays benign. It doesn't become malignant and kind of form into a metastatic form where it kind of spreads all throughout her body, and to avoid any sort of relapse. Now that's it with really our white blood cell notes. Kind of the only other things that you could consider are just some of these different therapies. Again, stem cell transplants are a huge one that's becoming more and more common, and as we look to target gene therapies there, and just look at how we can use stem cells to really mitigate a lot of these different diseases or in cancers. But if you look at the overall survival rates for children overall, compared back to 1975, we are steadily increasing with those overall survival rates. So we are looking towards a positive trend. Now, if you guys have any questions, concerns over this, don't hesitate to ask me. Otherwise, have a good day.